Orygen is a unique structure in the world of mental health and the world of mental health research. It's the only place in the world where we focus on clinical care, early intervention research, and translation of that research as a main focus for our work. Focusing on young people is a deliberate strategy because the onset of most mental disorders occurs in this period between puberty and the mid-20s, mid to late 20s, and very few research programs have actually adopted that approach of focusing on emerging mental disorders in young people. Orygen was born out of a dissatisfaction with traditional psychiatry, with its diagnostic approach, with its culture of care, and with its low expectations. We've got very high expectations for young people with emerging mental illness. We believe they can all potentially recover, they can all lead positive, contributing lives. We've actually had to change the whole culture of clinical care and research by involving young people in co-design of both the clinical structures and also the research projects as well. And it's been incredibly successful having the young people's voice shaping what we do.
I think it's really important for young people to be involved with mental health research because it's treatment for us. Actually involving young people, getting their ideas and opinions makes it more tailored towards what they actually need. The platform team is a group of young people who are consumer advocates within the service, and we get together every now and then to discuss things that we think we could do as young people and consumers to make the service a bit better for other young people. Some of the things that we've been involved in with Platform have been training staff. So we go and give talks to some new clinicians, new doctors, nurses, people that'll be working with young people, because it's quite difficult to understand at times, what's going on in somebody else's head. So I find that being able to share my opinions and experiences within a service and actually have people take on board what I say, it makes you feel very valued.
Our approach to recovery is really to look beyond the symptoms, to look at the things that are important to young people in terms of the life that they want to live. So in particular, we look at things like education and employment. And we'd also be keen to look at other areas such as physical health, housing, and relationships as well. The research program that we started off developing about 12 years ago now sought to fill a really huge gap, which was the fact that young people with mental illness just didn't return to education or employment, and that had an ongoing effect across the rest of their life. It meant that they were less likely to be able to become independent adults, less likely to live by themselves, and more likely to be welfare dependent across their whole life, even though that's the last thing that they wanted. So our research sought to fill that gap and reconnect people with their vocational trajectory. It's no longer sufficient in mental health treatment to think only about symptoms. We need to think about functioning, and we need to return the individual to the life that they want to live rather than just concentrating on reducing the severity of their symptoms. It's not enough anymore.
Youth suicide rates have been going up over the last 10 years, and there's been a lot of investment in suicide prevention across Australia. But despite that, rates of suicide have been increasing in young people. So we really felt we needed to go back to the drawing board and ask young people what they'd like to see done differently when it came to suicide prevention. They want suicide to be spoken about very openly in the community, and particularly in school and other educational settings. They've told us that they very much see technology as part of the solution, and I think a lot of people like to think of technology as part of the problem. And they also told us that they really want non-stigmatising and inclusive models of care. And that's really informed the work that we've been doing here at the Suicide Prevention Research Unit. We've been working to develop a set of guidelines called the ChatSafe Guidelines, co-developed with young people and suicide prevention experts from around the world to help equip young people talk about suicide safely on social media platforms. And we've made great effort to include young people who are often marginalised in society. So we've worked with lots of different groups of young people who are overrepresented in the suicide statistics. And what they've said to us is they've really felt that their voices were being heard and they've had the opportunity to make a difference to other young people's lives.
What's unique about Orygen's approach to borderline personality disorder is first that it's accepted as one of the severe mental disorders in young people. Secondly, we take a developmental approach that recognises that the peak period of onset for borderline personality disorder is starting at puberty and ending in the mid-20s. And it really underscores the need for prevention and early intervention for this disorder. Our work aims to change the life course trajectory of people with borderline personality disorder, and recent clinical trials have shown that early intervention is effective and that it changes the lives of young people with borderline personality disorder. It doesn't just change the features of the disorder, it changes functional outcomes, suicidality, and it also has an enormous impact on their well-being. There's a lot of discussion in the field about classification of borderline personality disorder rather than discussion about doing something about the problem. So we would encourage people to engage with young people with borderline personality disorder, offer treatment, and avoid harming people.
If psychiatry is going to progress, we've got to be a lot more confident. We've got to invest much more in these early stage approaches to illness. We have to move beyond the old dichotomy of child and adolescent and adult psychiatry. We've got to focus on this youth paradigm which enables early intervention. There's a huge opportunity here for international psychiatry to engage here. We have international researchers and clinicians that come and work with us here in Melbourne, and we're particularly looking for young, emerging clinicians and leaders and researchers to get on board and help us with this global challenge.